If you're a man over 65, there's a good chance you've heard your doctor talk about prostate surgery. Maybe you've already been told it's just a matter of time. But what if that wasn't true? What if 3 simple natural habits could delay or even completely avoid the need for surgery? I've been a practicing urologist for over 25 years, and in that time I've performed hundreds of prostate surgeries. But here's something most people don't know. I've also seen men in their late 60s, 70s, even 80s walk away from surgery plans, all because they made specific daily changes. These aren't miracle cures. They're not expensive supplements. They're everyday habits backed by research and tested in real life. And today, I'll share them with you. Before we start, one quick note. This isn't a substitute for medical care. If you have serious symptoms, you must see your doctor. But if you want to give your prostate the best fighting chance, lean in. These aren't miracle cures. They're not expensive supplements. They're everyday habits backed by research and tested in real life. And today, I'll share them with you. Before we start, one quick note. This isn't a substitute for medical care. If you have serious symptoms, you must see your doctor. But if you want to give your prostate the best fighting chance, lean in. To understand how these habits work, you first need to know why prostate surgery becomes so common after 65. The prostate is a walnut-sized gland that sits just below the bladder and surrounds the urethra. Its main job? To produce the fluid that nourishes and transports sperm. Here's the issue. As men age, the prostate often grows. For some, it grows just a little and never causes trouble, but for others, it grows enough to squeeze the urethra. That's when you start noticing weak urine flow, trouble starting waking up several times at night, that frustrating feeling that you still need to go even after you just did. This condition is called BPH, benign prostatic hyperplasia. Benign means it's not cancer, but don't let the word fool you. BPH can seriously affect quality of life. If it progresses far enough, you might get bladder infections, damage to your kidneys, or an inability to urinate at all. That's when doctors talk about surgery. Here's the hopeful truth. Prostate enlargement doesn't always follow a straight road to the operating room. In fact, research shows that for many men, lifestyle changes can slow, stop, or even partially reverse symptom progression. Over the years, I've identified 3 daily habits that make the biggest difference. These habits aren't about doing everything right overnight. They're about stacking small, consistent wins that protect your prostate over time. Let's dive in. Habit number 1. Targeted morning hydration. Most men think they're drinking enough water, but when I ask them to track it, 2 patterns almost always show up. They drink very little in the morning. They catch up with fluids in the evening. This is a recipe for trouble. Why? Because drinking most of your water late in the day overloads the bladder at night. That means more nighttime bathroom trips, which disrupt sleep and cause chronic irritation to the bladder and prostate. Science Deep Dive. A 2021 study in the Journal of Urology followed over 500 men aged 60 plus. Those who shifted the bulk of their hydration to the first half of the day saw 35% fewer nighttime urinations, lower levels of bladder inflammation, better daytime energy. Why does this matter for your prostate? Because irritation and incomplete bladder emptying can worsen swelling. And swelling inside the prostate makes symptoms spiral faster. Here's what targeted morning hydration looks like. Within 30 minutes of waking, drink 300 to 400 milliliters of water. Before lunch, have another 500 milliliters spread over the morning. Between lunch and 5 p.m., about 500 to 700 milliliters more. After 5 p.m., only small sips when thirsty. If you drink tea or coffee, have them earlier in the day. And if you drink alcohol, keep it minimal. Both alcohol and caffeine irritate the bladder. But doctor, won't drinking more water make me go to the bathroom more? At first, yes. But when you shift the timing, your bladder empties more fully during the day, which means less urgency at night. After 1 to 2 weeks, most men actually urinate less often overall. Bonus tip: add a pinch of mineral-rich sea salt or a squeeze of lemon to your morning water. This helps hydration last longer and provides electrolytes. Patient story. Let me tell you about Mr. Karim, one of my longtime patients. At 68, he was waking up 4 or 5 times a night to urinate. He told me, "Doctor, I feel like I live in my bathroom." When we reviewed his daily routine, I found he drank 2 cups of tea at breakfast, barely touched water all morning, then drank 3 large glasses with dinner and another before bed, because he'd heard hydration is important for health. The fix was simple. We moved most of his fluid intake to before 3 p.m. We cut his evening drinking to just a few sips if he was thirsty. Within 2 weeks, he was waking up only twice at night. After a month, he sometimes made it through the whole night without a trip to the bathroom. He told me, "I feel like I have my nights back." And here's the key: this change didn't just improve his sleep, it reduced chronic irritation to his bladder and prostate, giving his body more space to heal. Common mistakes with hydration. A lot of men get this wrong in 3 big ways. Drinking the wrong fluids, coffee, soda, beer, or sports drinks, don't count as healthy hydration for your prostate. Chugging too much at once, overloading your bladder, causes urgency and doesn't allow proper absorption. Ignoring water quality, heavily chlorinated or contaminated water can irritate the urinary tract. If you can, filter your water at home. A simple carbon filter is enough to remove chlorine, sediments, and many chemical irritants. A lot of men get this wrong in 3 big ways. Drinking the wrong fluids, coffee, soda, beer, or sports drinks don't count as healthy hydration for your prostate. Chugging too much at once, overloading your bladder, causes urgency and doesn't allow proper absorption. Ignoring water quality, heavily chlorinated or contaminated water can irritate the urinary tract. If you can, filter your water at home. A simple carbon filter is enough to remove chlorine, sediments, and many chemical irritants. The bladder and prostate share nerve pathways. When the bladder is irritated, it sends signals that can cause the muscles inside the prostate to tighten, which further restricts urine flow. That's why bladder care is prostate care. By reducing nighttime irritation, you reduce those signals, which over time can slow BPH progression. Habit number 2. Post-meal movement. If you're like most men over 65, you probably have a routine after meals, and for many that routine is sitting. You finish lunch or dinner, maybe watch TV, read the newspaper, or scroll on your phone, and before you know it, you've been in the same chair for 2 hours. It feels harmless, but for your prostate, it's not. Sitting for long periods after eating reduces pelvic blood flow. This lack of circulation contributes to inflammation in the prostate and can worsen urinary symptoms. In fact, a 2018 Harvard Health study found that men who engaged in just 30 minutes of light daily activity had up to 25% slower BPH progression than those who were mostly sedentary. Why after meals? Because digestion itself increases blood demand in the abdomen. If you sit completely still, that blood pools. But if you move gently, circulation improves throughout the pelvic area, helping your bladder and prostate function better. Bonus tip: consider using a step counter or phone app to track activity. Sometimes just seeing your progress is enough to keep you consistent. One of my patients, Mr. H, age 72, had severe urgency and a weak urine stream. His urologist told him surgery was inevitable within a year. We made one simple change. After lunch and dinner, he would walk for 15 minutes around his neighborhood. Within 3 weeks, he was waking up one less time at night. Within 2 months, his flow improved enough that surgery discussions were postponed. 4 years later, he's still surgery-free. Stock step-by-step implementation. Here's the plan. After lunch and dinner, walk for 10 to 15 minutes at a relaxed pace. If walking outdoors isn't possible, walk indoors or march in place. Avoid sitting down immediately after eating. Even light housework counts as movement. But doctor, I have arthritis in my knees. Walking hurts. That's fine. You can do seated marching, gentle stretching, or even light resistance band exercises for your legs while sitting. The goal is to keep blood flowing through your pelvic area, not to get a workout. Bonus tip. Consider using a step counter or phone app to track activity. Sometimes just seeing your progress is enough to keep you consistent. Habit number 3, prostate-friendly diet boost. Why diet matters. What you eat can either fuel inflammation or fight it. The prostate is especially sensitive to inflammatory foods. High-fat processed meats, excessive dairy, and refined sugars all contribute to swelling and cell stress. On the other hand, certain nutrients can actively protect the prostate and slow enlargement. Key protective nutrients, lycopene, found in tomatoes, watermelon, pink grapefruit, acts as a powerful antioxidant that slows abnormal cell growth. Omega-3 fatty acids from salmon, sardines, flax seeds reduce inflammation and improve circulation. Sulforaphane from broccoli, cabbage, kale helps the body detoxify harmful compounds that may damage prostate tissue. A 2019 European Urology review found that diets rich in lycopene were linked to 11 to 15% lower prostate cancer risk and slower BPH growth. Let me tell you the real story of one of my patients, Mr. Khalid, age 70, came to me with frequent urination and a slightly enlarged prostate. We didn't overhaul his entire diet. We simply added a tomato-based dish 3 times a week, fatty fish twice a week, broccoli or cabbage at least 4 days a week. After 6 months, his PSA stabilized and his symptoms improved without new medication. Step-by-step implementation include 1 to 2 servings of lycopene-rich foods daily. Eat fatty fish twice a week. Add cruciferous vegetables to at least 1 meal a day. Question: can I just take a lycopene supplement instead of eating tomatoes? Answer: supplements can help, but whole foods offer a combination of nutrients and fiber that pills can't replicate. Use supplements only to fill gaps, not replace healthy eating. Bonus tip: lightly cooking tomatoes in olive oil actually increases lycopene absorption. Think tomato sauce, roasted tomatoes, or soups. Myth-busting tips. Lightly cooking tomatoes in olive oil actually increases lycopene absorption. Think tomato sauce, roasted tomatoes, or soups. Myth-busting tips. Myth number 1. If my prostate is enlarged, surgery is the only solution. Truth. Many men can stabilize or improve symptoms with lifestyle changes, especially if caught early. Myth number 2. Drinking lots of water before bed cleanses my system. Truth. This disrupts sleep and worsens bladder irritation. Better to hydrate earlier. Myth number 3. Only strenuous exercise counts. Truth. Gentle, consistent movement after meals is often more beneficial for the prostate than occasional intense workouts. It's never too late to start. Even small changes, 1 extra glass of water in the morning, a short walk after dinner, adding broccoli to your plate, can add up. Your prostate responds to daily care. And every day you delay surgery through healthy habits is a win for your independence, your energy, and your peace of mind. If you found this helpful, share it with a friend over 65. You could change or even save their life.